An on-layer crown is an indirect procedure where conventionally you had to take impressions of the teeth, put a temporary there and then send them away, and it can take anywhere between 5 days to 10 working days. So what we do is we have this system called the E4D system. It's a one-visit crown and onlay system where they come in, we take the impressions. We don't have to take even impressions of the teeth. We can actually scan it into the system, and that's the new technology which we have. And we can actually design it on the spot. So they're just waiting for 20 minutes and then cement it on the same day. So this patient, for example, she really hates anything in her mouth. So if you have to take an impression, she'll just gag, and she's a very nervous patient. So what we did is we scanned this into the system, and now what we do is we design it. And to design it, what we do is we just give the computer like some points, the data where we say, okay, this is where the margin is, and then we, give that margin so that the computer knows. And also what it does is correlates with the teeth on either side, so the height and the width of it. And then we do the design process. So that's the completed design process where it exactly tells us what is the height, what is the depth, and what's the contact point. We can also look at the thickness to make sure the thickness is there so that the material we use, it's not too thin, so it's good that it's got the strength, and also to just make sure that everything's okay sort of with the contact points. And once we're happy with everything, we just hit the send button, that is mill, and it basically mills it. To sort of understand what it is, it's like a 3D printer, comes back, and then we just polish it off and then cement it for the patient. So the good thing about it is they don't have a temporary. So basically if they have a temporary, the temporary can break, or it can be sensitive, or they'll have to come back for second procedure. And as you know, it's people don't like coming to the dentist because there is a pain factor involved, and we have to give them another needle sometimes. And now when they're numb and they're waiting for 20 minutes, they come back, we cement it for them, and it's all done. So it's all done in one appointment. So very, very fortunate that we are able to sort of provide the service for the patients because not a lot of practitioners out there can have the system and afford it. So that's why we do believe in spending and investing a lot in technology, because we know that for the patients that's the best thing, because that's what they feel comfortable. And also, if I was a patient and they said I can do it then and there, why not? And that's where that's what we want in life, and that's what we can offer.